Just with the coronavirus newscast in an hour after we go later than Bill to join the debate with Fiona Bruce.
Welcome to Question Time. On tonight's panel, Grant Shapps, Secretary of State for Transport and former chairman of the Conservative Party, Labour's newly appointed Shadow Chancellor and former Shadow Treasury Minister Annalise Dodds, Jean Freeman, the Scottish Government's Secretary for Health, joining us down the line from Edinburgh, leading UK scientist, former President of the Royal Society and Chief Executive of the Francis Crick Institute, Sir Paul Nurse, and George Osborne, editor of the London Evening Standard, a Conservative MP for 16 years and for 6 of them, of course, Chancellor of the Exchequer. So good evening. Welcome to my guests here in the studio, socially distanced, of course. Jean Freeman, thank you for joining us from Edinburgh. And, of course, we have no studio audience here for the reasons that we all know. But this week we have taken pre-recorded questions from Leeds, and we've also been hearing from you at home via social media. So I will be feeding those in to the panel as we go throughout the programme. And, of course, you can continue to join the conversation on social media at BBC Question Time. So do join in. So let's take our first question, which is from Hannah Robinson.
Britain is set to have the worst death toll in Europe from COVID-19. Where a decade of austerity has left us massively unprepared. There will be an economic cost as a result of this crisis. How will you ensure that it's not paid for by the poorest in society with further austerity measures?
It's going to be a big bill at the end of this, Grant.
Yeah, first of all, I just want to caution against looking at the figures that we're all now very aware of coming out every day at the press conferences and making an assumption about where that puts us in the global league table. There was a very good article by Professor David Spiegelhalter in today's Guardian where he explained why you can't just do those comparisons in quite the same way. But I think the question is a wider one.
Hang on a second. The reason Hannah is making the comparison, I believe, is because obviously you show the graphs at the press conference, and today, as yesterday, it showed Britain on course, by the looks of things, have the worst death toll in Europe. I mean, Paul Nurse, you'd know about this. What's your view?
These are very difficult to compare, so we have to be careful about it. I think it'd be fair to say we're not doing very well, though.
We can, get into a sort of, a discussion about the statistics, but my point is that we need to judge it at the end of this when we can look at the excess deaths in any given year, which I think is the sort of scientific way.
Do you accept what Paul is saying, that we're not doing very well?
Well, I think that when you look at where we started on this, as has been said and was reckoned at the beginning, a reasonable worst-case scenario was 500,000 deaths.
That's if we did nothing.
Right, but we haven't seen what we saw in other countries. If we saw those pictures, which we all looked upon in horror, where Italy were ahead of us and the hospitals were overflowing and people were literally on the floor or outside the hospitals themselves. We haven't seen that at all. We've built 8 Nightingale hospitals in next to no time. I can tell you actually today, capacity in urgent care, critical care rather, is about 50% available, and numbers in critical care are falling. So lots of things like that and bringing in incubators have gone very much to plan, thanks to the enormous efforts of everybody in the NHS and beyond.
So why are our deaths so high, then? That's what I don't quite understand.
Well, I defer, of course, always to medical and scientific advice, and that's what the government's been doing all the way through. But the scientific advisors in government were saying today there are lots of reasons of demographics. For example, it depends on the age of your population, the density of population, things like obesity play a big part, so the health of the population. And you can see if you look at, for example, the southwest of the UK and down in Cornwall, the deaths are relatively low, whereas in London at the beginning, much more dense, compact city, much higher. So there'll be lots of factors, but the key factor to look at the end of this is the excess deaths over a normal year. And I encourage people to look at that article in The Guardian, where that professor goes into a lot of the more detailed reasons.
Since we've got you here, Sir Paul, what's your view on this? This is obviously part of Hannah's question, but let's deal with it now.
Yes. Well, it is difficult to make comparisons between different countries. They count deaths and so on in different sorts of ways. We will have to look at it at the end, but I think we are right to think that we could be doing better. And there's various reasons for that, which I hope we'll explore during the programme.
What do you think they are?
Well, I would start with the fact that we were totally unprepared for it. and we should have been prepared for it. I mean, the fact was that there was a review of the functioning of the NHS, how it would work in the pandemic. It happened to be an influenza one. It was never published. It was about 3 years ago.
This is the Cygnus report.
Exactly. And we didn't do well. In fact, we failed. Now, was there any action there? I didn't see any action. Wasn't even published. So the austerity was mentioned. I mean, was the NHS well enough funded to actually take that report seriously and lead in the when the pandemic took place in really getting on the front foot? We have been playing catch-up for this entire pandemic. And I think when it's analysed, we will see that we didn't do very well. But you're right, we have to look at the figures carefully, and that it's still out there exactly where we would be. But it's our lack of preparation which was the start of our trouble.
Look, I don't want to say that everything is perfect and there's nothing you could have done differently. That would be ridiculous, clearly. No. But it is the case that in some of the best healthcare systems in the world, Italy, Spain, for example, they had similar, in fact, worse problems. And the sort of preparation that was taking place for a pandemic was what you might sort of call an ordinary influenza pandemic, whereas what we've got is something very global in nature, which has led to big shortages in things like PPE and the rest of it. And I think, given all of those circumstances, and of course we'll have to judge this at the end, as Sir Paul was saying, but given those circumstances, the way this country has responded has been remarkable and impressive in many ways, with those ventilators being offered up by 12,500 companies coming forward to see how they can help. And a lot of those offers being taken up now with Lord Dighton behind it.
Well, please call me Paul. I only use Sir for fundraising purposes. I have to say.
Okay, we'll bear that in mind.
But I think there were some very simple things that we should have had. A warehouse or two full of protective clothing. That would have been simple to do,
but
and that was really not right. We didn't
just
have
to
it.
understand the scale of this thing, a warehouse or two we actually probably had. What we needed was 1 billion pieces delivered so far, and more pieces all the time. 12 million
a billion
pieces today,
including single gloves.
Well, single gloves, yes, but also pairs of gloves, but also 4 gloves counted as one. Okay. So it's not as straightforward as that misleading story represented.
Let me bring Annalise in.
Well, I think very few people would say that the preparation was there to the degree it should have been. But to be completely honest with you, I'm not here to put blame on anyone. I'm here to say, what can we do to fix this? And my goodness, we need to fix it. And we need to deal with the blockages, and we need to listen to what people on the front line are saying to us and take action. And, that's what we've been trying to do. So, for example, around the enormous shortages that still exist in protective equipment, and, we saw that in the Panorama programme that was on recently, there are shortages. We've set out a whole range of things that we think need to be done to deal with that. Around testing, obviously, we've just missed the target that was set out before. Now, I'm not going to jump up and down and say, isn't that, an incredible thing? We've got to deal with it. We've got to fix it. Well, it was that 100,000 target.
Just to be clear, there are now over 90,000 test capacity today. That's the figure today. Over 81,500 tests were carried out today. We'll see tomorrow whether we've met that 100,000. We don't know that we've missed it. And there's more labs coming on board. Okay. So, for example, Cambridge super testing lab doesn't even open till Monday.
OK. Well, I know, Paul, I'm sure you've got quite a lot to say on testing, which Indeed. We may come to in a moment. Let's just deal also with the other half of Hannah's question, which is, can you ensure that the economic cost of this crisis is not paid for by the poorest in society with further austerity measures?
Well, I think what Hannah highlighted in her question was that the decisions that have been taken over the last 10 years have left us unprepared. I mean, if you look at social care, for example, we had 120,000 vacancies in social care even before this crisis started. We've been talking about the decisions that were taken in the NHS because of a lack of funding, actually. I mean, we did have that additional funding in the 2000s. We didn't have additional funding from 2010 onwards, and that meant that other longer-range questions like preparedness seem to slip off the agenda. We can't be in that situation again.
So you're saying this is partly George's fault?
Well, I don't really care whose fault it was. George's fault, I
don't know. He's sitting there, you might have
I think the statistics do make the case very, very clearly. I'm not going to kind of point the finger, but we had that lack of preparedness and lack of resilience in our public services. But this is also about, of course, households financial resilience as well, with now approaching 9% of our population due to be unemployed. We entered this crisis with a quarter of families not having even £100 of savings. And that's after the longest squeeze in living standards that our country has seen for 8 generations, the slowest recovery it's seen after a financial crisis for hundreds of years. Now, that is something that we cannot repeat.
So, George, your record is being called into question here. And also, in terms of Hannah's question, how can we ensure it's not the cost of all this is not paid for by further austerity measures? So, do you think you're partly responsible for the situation the NHS is in? And then how do we get out of this? What is the answer to it economically?
I think there's a sort of terrible trap in the sort of British political debate, which is that somehow Britain is unique, that we're either uniquely bad or uniquely good at things. And in all the elements of Hannah's question, Britain is experiencing things that other countries like us are experiencing. So first of all, on the pandemic itself, I think we're kind of middle of the pack. We're not as good as the government claims, clearly, but nor are we as bad as some of its critics say the government is. We haven't had the testing in as quick as we'd like. We probably went into the lockdown too slowly. But on the other hand, as Grant was just saying, the hospitals haven't fallen over and the capacity has been built and people are getting the ventilators when they need them.
It's also a very different story in social care.
But even in social care, other countries in Europe are having terrible problems in social care, and even and things like protective equipment. We all saw in Germany, which we know has been doing very well, the doctors all protesting that they didn't have the protective equipment. So, Britain is not unique. I think we're somewhere in the middle. In terms of preparedness, clearly we were not as well prepared as we should have been for a pandemic that was not a pandemic flu. And all the, contingency planning that I saw many years ago was about pandemic flus, and that wasn't just a bunch of politicians thinking that the pandemic flu was the thing you had to prepare for. That was what all the expert community was talking about, and I think they're going to be very serious lessons. But again, no country was particularly well prepared, particularly in the West. And then finally, on austerity, the last time I was on Question Time was 10 years ago, and we were having a similar debate. I was the Shadow Chancellor. And the truth is this, austerity in this country and elsewhere, in every country, was a consequence of a massive financial crash. And that's what blew the finances of every major economy. And there's a basic truth about economics, which is, in the end, yes, you can borrow your way through the emergency, but in the end, if your country's poorer than it was, and that sadly is going to be the case for us, we are going to have to face very difficult questions. It won't be me this time, maybe it'll be Annalise or it'll be Rishi Sunak as Chancellor, about how you cut your cloth. And you can either increase taxes because you want to spend more on things like the NHS, or you are going to keep taxes where they are, and then you're going to have to spend less. And that is just a basic rule of how countries' finances are. And I had to face those questions many years ago, and I believe we did it in a way that kept people in work. That government I was part of, more jobs were created than any government in British history. But am I saying that they were easy decisions? Am I saying that the poor and the vulnerable are immune when the economy crashes? Of course they're not. One of the tragedies of economic crashes is that they are often the most exposed, and you have to do everything you can to try and help them through.
But are you saying we could
there's a load of money when there isn't is I'm afraid, a regular mistake in politics.
Are you saying we could be in for austerity Mark II?
Well, I don't think it will necessarily be the same. I think hopefully the recovery from this, although the sort of drop is deeper because we've shut down the economy, I think the recovery will be more quick, it will take place more quickly. Financial crises, banking crises throughout history have been long and drawn out. Across much of Europe, they were only recovering from the crash, a couple of years ago that happened a decade ago. So I think the recovery will take place more quickly. But the basic truth is this, sadly, our country, because of this virus, is not as rich as we thought it would be. And so, therefore, just a bunch of people queuing up to say we want to pay everyone more, we want to increase welfare, we want a universal basic income, we want to spend more money on public services. I'd love all that to be the case. I live in this country and love it. But the truth is you've got to pay for it. And you can either be honest with people and say taxes are going to go up, and I was the person who put up taxes like VAT, or you say, I'm afraid we're going to cut our cloth accordingly. And that debate is only just starting in British politics. It's not happening now because we're in the middle of the pandemic. But the politics of this Parliament, and I suspect the politics of the next general election, years off as it is, will be all about the economy. The economy has moved back centre stage into British politics.
So, Jean, you've been listening patiently up there in Edinburgh. How are we going to pay for it?
Well, I actually want to start with where your questioner started. And I think for politicians, for all political leaders, our starting point, first of all, has to be that any single death, and there have been too many, is a cause of considerable regret. And my second point is that I don't think any political leader or politician in Scotland or the UK should ever claim that we are confident that we have got everything right so far, or that we will get everything right. We said at the outset that I think this virus is about 130 days old in terms of our emerging knowledge and understanding of it. And things change, and we have to be able to change our response and our approach. I think there have been real positives in terms of how our staff in the NHS and social care have responded in creating that significant additional capacity. Our ICU capacity today is a quarter of what it is capable of. And the public in particular have to be thanked from the bottom of our hearts for everything that they have done and all the sacrifices they have made to get us to this place where we are suppressing the virus. Not enough yet, but we are suppressing it.
And do you think Scotland could have taken a different path at any stage, Jean?
Sorry?
Do you think Scotland could have taken a different path at any stage?
I think Scotland's approach in this, my approach in this, the approach of our First Minister is, and I think this is quite important, and Annalise touched on it, and that is, in facing a pandemic, ordinary political disagreements have to be put to one side. I undoubtedly have significant political differences with Matt Hancock, my counterpart for the health service in England. I believe in independence. I'm sure he absolutely doesn't. But we have to find ways to work together because that is our best option for dealing with this pandemic, notwithstanding that we have a responsibility here in Scotland, I do for our health service, that where I think the evidence takes me to a place where the decision that is right for the people of Scotland, for the health and social care service in Scotland, would differ from any of the other four nations, that I clearly set that out because that's where my responsibility lies. I think we have had some preparedness. We do have a national distribution service to order, secure and distribute PPE. So there are differences between how our health services run between England, for example, and Scotland.
Sure. And Jean, just coming to the second half of Hannah's question, when it comes to paying for all this at the end of the day, how do you see that happening?
Well, I think Hannah has touched on a really important point. One of the key principles, if you like, that we set out in the document we published last week, which is really the beginning of a conversation with the people of Scotland. It sets out the framework of how we will make decisions about not only what steps might we ease coming out of the current lockdown, but also how we plan ahead for Scotland's future to renew our country. That includes our economy. But part of that is to say that whilst this is a terrible situation and we are by no means through it yet, we also can see that in that situation, some things have been thrown up in stark relief. The key workers, the people who are working in our health and social care services, who are delivering our food, working in supermarkets, keeping the basics of our infrastructure running, are actually some of the worst paid people in our society. And if we are going to maximise the chance to renew our country in Scotland, and I hope in the rest of the UK, then we need to take a serious look at how we want to address inequalities of income, inequalities of advantage, and that does include looking, for example, at the practicalities of a universal basic income. Now, in Scotland, we do not have all the powers that would allow us to introduce that, but it will be a conversation that we will want to have.
Well, let's put some of that to the panel. The question is about, amongst other things, about austerity. Will we see a new period of austerity? Now, interestingly, The Prime Minister at the press conference today, the first one he's done, obviously, since he's been unwell, he said the economy will bounce back strongly. And he then said, I've never liked the term austerity, and it certainly won't be part of our approach. Do you want to enlighten us a bit more about that?
Look, first of all, I think that the first thing I want to say is actually I agree with an awful lot of what was said about the way the devolved administrations have worked on this. It's been much more cross-country and cross-party as well. I speak to my opposite number quite frequently, including just yesterday, and we're working on several of the issues together.
OK, but in terms of what the Prime Minister said today...
Yeah, in terms of how we climb out of this, I don't think the word you attach is the important thing. The important thing is that we...
Well, he absolutely talked about, said, I've never liked that word, that term, austerity. He obviously feels it's important.
That's what it means. It doesn't like that word. But how you climb out of it is the interesting thing and the important thing. As George has said, clearly, we all know that you can't forever spend money that you haven't got. On the other hand, this could well be more of the V-shaped recovery that we hope it is. In other words, we went into it very steeply as the economy shut down. We may well open up the economy and come out of it. I don't think as a sort of straight line going up, but rather not as a sort of 10-year recovery programme. It is undeniable there will be new debt formed by it. I would venture to say that the world's attitude towards this, because it's happened on a global basis, may well be a little bit different to the financial crisis of 2008-9, where the problems there were banks literally at danger of going bust.
So we'll live with a big debt. That's what you're imagining.
I think the lending markets, the global markets, may now accept a certain level. That is an unknown as yet, and we'll have to see where we're up to, because we will not know for some months to come, and maybe more like a year or so, who knows, how the economy has come back out of this. Until we know that, we can't really judge the situation with the long-term debt.
But so if austerity is not going to be part of the approach, I presumably a tax rise might be?
No, I think that what we have to do is consider it for what it is, which is a crisis which, rather like a war, in fact, exactly like a war, you have no choice but to pay for. But as we saw, after the wars that this country's gone through, the last war, we came back and became a stronger country, and we can do that again. But I did want to respond to Hannah's original point, which is we will not do that kind of, as she said, sort of concerned about people who are the least well off. We were elected, this government in particular, were elected only in December on the basis of the left behind communities, the towns that felt that the world had moved on without them. A lot of my work to do with being Northern Powerhouse Minister in the Cabinet, to do with the levelling up agenda and all of that stuff. And we will not forget that. In fact, today, this very day, I've been working on that agenda. So when we come out of this, things like reconnecting communities by reversing those beaching cuts to railways and that sort of thing will be absolutely front and centre of our programme.
I think we should urge a little caution that we're just going to recover that quickly.
No,
we really don't know how this virus is going to behave. Now, we hope we will come out quickly, but we shouldn't assume that. We may have a recurring infection. We may be dealing with something that takes a number of years. I wouldn't, with complete confidence, think that we will bounce back quicker than the financial crisis.
I agree entirely.
We have to be really careful about that.
It's quite clear this is going to reshape our economy, our ways of working, and much else.
And this has
society.
also damaged us a lot more than the financial crisis. And Labour's talked about, well, Keir Starmer certainly talked about tax rises as one way out of this.
Well, yes, but I think we've got to be clear. I mean, George suggested that there are only going to be two choices, really, about how much more you tax and how much less you spend. But actually, there are two other really big choices. One of them goes to the heart of what Paul just said, which is about how we're going to actually boost demand as we start to climb out of this, because we've seen, obviously, people scaling right back on their spending. We're going to have to give people that confidence again. And, of course, what we saw, unfortunately, after 2010 was a reduction in that confidence in many areas, a dropping off in demand. That meant that the economic cake got smaller than it needed to be. It wasn't growing at the same rate. So we need to make sure that we have that growth. But secondly, we need to take decisions about where those cuts in services or increases in tax or reductions in tax fall. And if we look at what happened again between 2010 and 2019, the worst off 10% of people, particularly those with children, saw their incomes fall by 20%, according to the IFS. Best off 10% of people, as a result of successive budgets, they only saw that falling by 2%. So there was a big distributional choice taken by successive Conservative ministers. I'm not saying this to make a party political point, but we've got to have a new settlement after this, not just because, for those of us who don't like that level of inequality and that level of deprivation, that being morally abhorrent, but because it's meant we've got so many people who are in such a difficult, precarious financial situation now that as they fall into unemployment, they just don't have that ballast there. And if we're going to have continued disruption, we can't have that huge block of people in the British population who are in such difficult economic situation.
Well, I know you want to come back in, George, but talking of people and falling into unemployment, let's hear from another person who contacted us, Alaric Neville.
Hello. I run a medium-sized brewery business alongside working in the music industry. Both these professions have been severely disrupted by the measures needed to flatten the infection curve. The current government-backed help to keep us afloat has been very welcome. Do the panel appreciate that even when many restrictions begin to lift, help to keep small breweries, pubs and venues alive will be needed for some time before many can trade profitably again? Thank you.
I mean, the government has made this grand gesture of paying in terms of furloughed staff, and it's been welcomed by some. Some have fallen through the middle, and we've heard from a lot of people who have and who are getting nothing. But how you then get out of that and how you keep those businesses afloat is not necessarily straightforward.
Well, you have to. I'd absolutely take Paul's point that we're going to have to live with this virus, as far as I can see, for a considerable period of time until a vaccine is discovered and then applied to the population, if it is. And that's going to require different ways of working, and we're going to have to find ways for the entertainment industry and the brewing industry and so on to get back to some kind of life. I think sort of thinking that this country is going to go back to the world of February 2020 is a big mistake. I think it is going to be a new world we live in.
But some of those people who are furloughed are not going to have jobs to go back to.
So I've been a big supporter of what Rishi Sunak has done to throw money at the problem. You fix the roof when the sun is shining, as I used to say, precisely so you can deal with a storm like this. So you do have the credibility as a country in the financial markets to go and borrow, and the government's currently, I reckon, borrowing about £1 in every £3 we're spending on every nurse, on every police officer, on every furloughed person, on the pensions they're paying. So we're borrowing a huge amount, and we need to maintain international confidence, particularly when the Bank of England stops printing the money to pay for a lot of this, which is what is happening at the moment. I think that this issue of how you allow the economy to regenerate and how you withdraw some of these schemes is going to be very, very fraught and very contested in British politics. I say this now as an editor and observer of British politics rather than an active participant. Let's take the furlough scheme, which has been a lifesaver for millions of people. And, very sadly, in my company, people have been put on furlough in order to try and save the company and save their jobs. But the truth is this: if you left that furlough in place for years and years and years, there would be people who, frankly, were unemployed because they were never going to go back to a job, but weren't released into the labour market to try and find a new job. Now, that is, of course, what we need to do for them now and provide that support. But if you just allow it to carry on forever, and I'm talking not about this year, but in the years ahead, you've sort of left them in a limbo. And the same is true of some of these companies that are getting loans, and we all hope that they all come back, but not all of them will. And we have to be honest about that and start to have that discussion, even if it's not an issue we have to confront right now. And if you just keep, basically companies that have gone bust alive with a kind of credit line, you're again not allowing the people involved in that company to go off and do other things, create new companies and so on. It's a very, very tough set of choices which the government and indeed the opposition that wants to be the government are going to have to confront. But just saying, we've thrown all this money at it and we can go on throwing this money and go on borrowing £1 in every £3 that we spend is not realistic. And I am all for firing up the enterprise and getting their investment into the country and so on. Because the one thing that I think this generation of politicians is going to have to deal with, very sadly, is, which my government that I was part of didn't have to deal with, is unemployment. And that we have not seen in this country on a large scale for many decades. And that is very scarring, very damaging, obviously, for the people involved and their families and the communities. And really, that for me is another issue that's going to kind of come back center stage. And ultimately you need successful businesses that want to employ people and have the capacity to employ people. And there you have to allow those businesses that aren't going to succeed, sadly, to close. And you have to allow people who are furloughed, and I'm again talking not about this year, but in the years ahead, who are furloughed and are not going to return to the job they had, to go and get that new job. And that is going to be, to me, in my mind, the most difficult sort of decisions that these guys are going to have to make.
And so does the Treasury have an exit strategy when it comes to furloughing? And in terms of Alaric's question, he's talking about the hospitality business, pubs, breweries in particular. And who knows when they're going to come back on stream. So what does someone like he do?
Yeah, I mean, obviously there's a huge amount of uncertainty, and we all understand that. But we have the plans as we've set out at the moment, which is furlough continues till the end of June at the moment. It's the current timescale.
And are you looking at extending that?
Well, let's wait and see how we're doing. Leave this to the Chancellor come the time. But what I was going to say is,
I think we can be 100% certain it's going to be extended. Well, I know Grant can't announce that, but there's absolutely no way it's coming to.
It's an expensive scheme, isn't it? We're about $4.5 billion a month. So I wouldn't, this all depends on actually largely on ourselves, how we deal with the lockdown and keeping to these social distancing measures in the various different forms as we go forward. And what we don't know, of course, is how that Oxford University tie-up with AstraZeneca that we learnt about today is going to do if indeed those tests go well on the vaccine, and that could be a complete game changer.
Yes, we know that's going to be, even if they do brilliantly, that's going to be some time off. And you've got Alaric here who's saying, hang on, when it comes to the hospitality industry in particular, how are they going to begin to get back on their feet?
Yeah, and George is right. I mean, there's been a huge amount of initial assistance, £25,000 grants, not loans, provided to, I think, 500,000 businesses at this stage. They're not paying any business rates. I think half the businesses in Britain won't be paying any business rates, certainly including hospitality this year. But we can't put the sort of cart before the horse. What we have to do, first of all, is see the all-important R rate that we hear so much about and are going to be hearing much, much more about in society come down. We know it's, we think, between 0.6 and 0.9 at the moment. Then enable us, through the plan that will be released next week, to tweak social distancing, and there are many, many different aspects to this, and it's clearly you don't go straight from where we are today to pubs and clubs being open and therefore that problem being resolved. But there is a step-by-step
But just answer Alaric's question, will you help keep pubs and breweries alive?
I'd say our track record so far is we want to try to keep the economy intact so that if we're able to defeat this thing quickly, that they're still there. What you're inviting me to do is to sort of guess the future of...
Just answer the question, that's what I'm inviting you to do.
I am as best as possible. Nobody can see the future of this virus in the same way as you or I didn't see it coming in the first place.
Let me take another question now from John Chadwick.
If the government does not know who is carrying the virus in our communities, how does the government know where and when to lift restrictions on movement?
Paul?
Well, this is a very critical point. The only tool we have in our armoury at this moment is testing, 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 and the appropriate changes in how society works, which is built on that. So critical to the nation's response to the pandemic is testing. Was it put in place properly? Was it put in place rapidly enough?
And what's your answer to that?
Well, my answer to that is that I think we certainly could have done better. We weren't prepared for it, as I said. The policy that was followed, and that was a mixture of political and scientific and medical advice working together, decided to invest in large mega labs. And these labs will be absolutely essential, but because we didn't have the preparation, they take a lot of effort to get them to work. There's not simply putting the lab there, but there's the workflow, getting the samples there, getting them collected, getting the IT working, getting the results back in appropriate time. Anybody could have seen that that is going to be a very difficult thing to do. So the proper decision should have been, yes, to get the mega labs in place, but yes, to encourage as many other places, such as the Francis Crick Institute, which did respond to it, where you could do local testing. And that was critical, particularly in the healthcare worker sector.
And how much difference do you think this target of 100,000?
Do you know, the 100,000 target is just a figure with a lot of noughts in it. It was, as far as I was concerned, a bit of a PR stunt which has gone a bit wrong, you know? I mean, 100,000, I mean, why 100,000? Where was the strategy under that? I haven't seen a strategy under it. It just sounded good, and it's, of course, well, yesterday it was 50,000, at least the tests, but we shouldn't get hung up on that. The real reality is this. If we'd had local testing connected to local hospitals, we could have made hospitals a safe place. And what we had is the potential for having care workers working on the wards, working with sick patients who were carrying the disease and weren't being tested. Now, we heard Hancock say a couple of weeks ago, we've got the capacity, but the NHS workers are not coming forward. Do you remember that? Why weren't they coming forward? Because the NHS rules wouldn't let them come forward.
What do you mean?
They had such restricted rules on who could be tested that they didn't simply make the decision we have to test everybody who is a frontline worker. And in particular, they wouldn't test anybody who had no symptoms. We know that this particular disease, you can be infected and have no symptoms. Now, this makes absolutely no sense. We were allowing, potentially, for frontline care workers to be on the wards, potentially infecting people, because we weren't testing. Now, that may have been because they didn't have testing capacity throughout the country, but you can't simply say we don't need to do it because we don't have testing capacity. And even when we could provide testing capacity, we couldn't do it because of the NHS rules. Testing was absolutely critical. It hasn't been handled properly.
Jean, I wanted to come to you on this. I mean, John's question is, I mean, Paul's saying it just hasn't been done, but you're basically saying it's been a bit of a mess until relatively recently.
And I think we should have had the mega labs, but it hasn't been creative or imaginative in actually getting this going quickly and properly.
I mean, John's question specifically is, if the government, and obviously this applies to the Scottish Government as well, does not know who is carrying the virus in our communities, how can we know when and where to lift restrictions on movement? So what are you doing there in order to have a strategy for that?
So our initial strategy, of course, was what was described across the UK as the containment strategy. And that was when essentially you tested, you then tracked contacts, you isolated those. But as the virus had clearly much wider community transmission, we moved steadily into where we now are, which is lockdown. And our current testing strategy in Scotland is to certainly test key workers, to widen that now to beyond, we've widened it beyond health and social care. We are testing over 70-year-olds in hospital. We are testing symptomatic patients in our residents in social care. And we are testing new admissions to our care homes to make sure that we are not bringing the virus into those care homes. But I think we need to be a bit careful here that at the very outset of our experience of this pandemic, the evidence then, the scientific and medical clinical evidence and advice then said that asymptomatic people were probably not infectious. In fact, in some instances, the evidence said
I'm sorry, but that isn't simply not correct.
Hang on, sorry, Paul's just taking issue with that. Sorry.
Yes, I'm taking issue with it because we have known for...
Sorry, Jean, just hang on. Jean, just hang on 1 second, just because this is your specialist area, obviously, Paul. You're taking issue with that.
Yes, we've known for a significant period of time, and it's been known across the world, that those who are infected do not always have symptoms. And the policies should have been governed by that fact.
What Jean was saying is that asymptomatic people may not be infectious. That's what she was saying.
Yes, but what I'm saying is that people without symptoms are infected and therefore potentially will be transferring the disease. And that is a really significant issue.
Jean?
Yes, it is a really significant issue. What I was saying was 2 points. First of all, that the evidence that we were looking at, and indeed I think the UK government was looking at, was that people without symptoms were unlikely to be infectious, but more importantly, that the test itself really was only at its most effective if you were symptomatic. So as I said earlier, this virus is, 130 days or so old here now in the UK and Scotland and the rest of the UK. Undoubtedly, we are learning as we progress. And the key is that our strategies and our response needs to be fleet of foot. So we are now moving. We have increased our testing capacity in our NHS labs here in Scotland. All our boards now, by the end of next week, will have that individual capacity to gather those tests, so that in a country like Scotland with remote and rural areas is particularly important. And we will set out next week our strategy for test, trace and isolate, which, regardless of what we do in terms of easing the current lockdown measures, will be a central part of our response.
Right.
But I also think we need to be careful that at the moment, my understanding is that the reproduction rate is considered to be under 1. That's significantly different from at the start, where it was round about 3. It's under 1. We're not confident yet about how far under 1 it is.
Okay.
And therefore, the room for manoeuvre in terms of what measures might you ease at any one point is very
yes. I mean, the question is not necessarily about what measures might we ease, but very specifically, John, in fairness to John, he's not looking backwards. He's trying to look forward and say, OK, how do we find out who's got the virus? And so, and if we don't find out who's got the virus, how can the government know when and where to lift the restrictions? Annalise?
You know, I think this is an area, one of many, where we really need to see transparency. And obviously, we've been trying to be constructive around this and having those discussions with government and saying that it needs to be very open around these questions. I mean, people will remember there was a debate a few weeks ago about how we were going to have antibody testing, so that testing looking back to see if people had already had the virus, that was going to be widely available. Now it appears that perhaps those tests aren't as accurate as initially it was thought, that we wouldn't have the large numbers that initially we were told we would have. Again, with the testing capacity that's going to be necessary for us to have a pickup in lots of different kinds of activity, I think we've said we really need to see a plan around this. We've got to have confidence in it. And actually, that relates to the previous question. We need to make sure that there's buy-in to this process right across society, across business, employees, trade unions, everybody. Otherwise, it's not going to work when we come out of these different forms of lockdown, because you'll have debates and discussions about different workplaces, about whether one activity is safe and another one isn't. We need to have that clear and inclusive process. And certainly, you know, I've said to the Chancellor, I want to work with him on that. And we've got to do it very openly, because otherwise you will have people raising questions about it and it won't work to the extent that it could.
Grant, we've had some tweets in about this. So Dan Bradshaw, who's a paramedic, has said the government have failed NHS staff from the beginning of this crisis. That's his view. They're still failing to provide PPE and adequate testing to frontline healthcare workers. I'm a frontline healthcare worker and was tested almost 5 weeks ago. Still no results.
I don't know what's...
When is the government going to get a grip?
Yeah.
Another one, Lindsay Thomas, who is a GP. What is the rationale behind the criteria for testing? Again, this comes back to strategy. So not a target, a strategy. As a GP, I can't test patients with symptoms, so it's all guesswork. Surely it would make sense for us to test patients feeling poorly enough to seek our help.
Well, let me try and bring everybody up to sort of date on where we're up to.
Well, what's your response to those?
I'm going to answer it. Right now, today, there are testing capacity of 90,000, and when we look back tomorrow on where we end on, we did over 81,500 tests yesterday. Let me just finish the point. I'm just going to answer the point.
It's just a question about a strategy rather than a target.
But I'm trying to answer both the questions at the same time. It's very likely, or quite possible, tomorrow that we'll see that we in fact did reach the 100,000 today. Whether or not we did, as you point out, doesn't precisely matter whether it's 100,000 or not. The point is to have available tests. And to those tweets and to the questioner, the good thing is now that you can go onto the gov.uk website. If you are a worker in hospital, a nurse, doctor, anybody in hospital, if you are in a care home, location, either as a resident or even or as somebody, a care worker.
It's not much good if you have to wait 5 weeks.
I don't know what happened in that particular case, but the fact of the matter is you can go online now, as I checked this morning and again this afternoon before I came here, and you can book a place, and you can do that either by going to a test centre, not always so good if you're in a place of work, or by getting a home test. To give you an example of the speed at which this has scaled up, at the beginning of the week, we only had 5,000 home tests available. This is now 20,000 available, and it's the reason why we're quite likely to get very close to or meet the 100,000 target. And the point about this is somebody needs to, and to both of those tweets, be able to simply go online, order it themselves, and get it done.
But what about knowing where and when or who has coronavirus, and therefore how can you live restrictions? That's about contact tracing,
so the other thing that
which you stopped quite early on. When's that coming back?
So I was going to say the other thing that we've done is actually expanded it to both symptomatic and asymptomatic care workers, for example, so people can take this test if they're just concerned at this stage. And in terms of the test, track and trace thing, we started off with very low capacity, though I entirely accept Paul's point, he's the expert in this. But we started
you said
off
the point that you were too slow?
And PhD England were doing all the testing initially, and we started off at about 2,000 tests, I think, at the beginning of this crisis. It's now getting to 100,000 or even above, and there's another super lab opening on Monday in Cambridge. So the testing capacity is there. We had to create that testing capacity for the most part, though I accept there may have been things that PhD or others maybe could have done sooner. You're the expert on this, Paul. But the fact is, it's a huge effort to build this up. We couldn't maintain that process of the tests that we had when this got large enough that it was in society. We focused the available testing, rightly, I think, and on scientific advice, in the hospitals, in the settings which actually required the frontline testing. Now, in the ideal world, if we were to do this all again, we'd have a 100,000 test capacity and more from
just
the
on
outset,
contact
because I think it's very important. And on contact tracing, we're looking for that app to be able to be available in the middle of May. This is just to remind people, this is an app that you'll download on your phone. It will see if we have Bluetooth contact between us, all anonymously done. And if I'm then tested and I'm positive, it will give you the heads up so you go and test yourself. So that sort of contact testing, tracking, tracing and isolation will be, I think, quite an important part of taking this forward.
Okay.
So
I will come back to it. I just want to bring George in. Does that strategy sound clear to you?
I think testing, as per the original question, is critical to easing the lockdown and using technology as they've done in South Korea and these other Asian countries. Even with the intrusion on our privacy that's going to bring, I think is also going to be critical to getting the economy back on its feet. You know, what everyone's alluded to here is, frankly, you know, the difficulties in getting the testing program off the ground, the enormous bureaucracy that you know was encountered, the failure to involve people outside Public Health England and laboratories like Paul's. And I actually think Matt Hancock did the job that sometimes a Secretary of State needs to do, which is, here's a bloody great target and go and hit it. And I think he's got a pretty good chance, amazingly, of hitting it. I would just say one thing, let's not repeat all this if we get a vaccine. You know, we should be planning now. I have no idea I'm not a scientist, I have no idea whether a vaccine is going to be developed, you know, in 2 months' time or 2 years' time. But when it comes, you know, if a government can't vaccinate everyone in the population who wants that vaccine pretty quickly, then I think they will be in real trouble. So I think they should be learning from this experience, not just, by the way, the politicians, but the people who run the NHS, and working out how once the vaccine is discovered, which we'll hope will happen, it can be applied. And that, to my mind, again, think ahead to where you're going to be hopefully in a few months' time, maybe in a few years' time.
And I want to get another question in, but Paul, just before I do, you want to come back quickly?
Testing's critical. Actually, I'm not an expert. I work on yeast. I just learned all this in the last month or so, if I may say. Testing was critical, but what we were hearing, because I mean, we've been in the front line over this, over the last a number of weeks, is that frontline workers have been begging for testing, and they haven't been provided it. I mean, 9,000 community nurses in North London, they would have 5 tests a day. I mean, this is no way to run a ship, in fact. And we need to deal with it. Then we have this question of capability of testing.
Capacity.
You know, the capacity. Now, I mean, you're a transport minister. Let's take a train metaphor, all right? We're travelling from London to Paris, OK? Now, the Channel Tunnel may have capacity for 10 trains an hour, but if you only get 3 trains an hour to the station, to the tunnel, and 3 trains out, you will have only testing at 3. And the real problem we're having here is the workflow of getting actually the samples out, getting the IT sorted, actually putting the whole process, a focus just on the mega labs without dealing with the workflow. Now, that was obvious to us weeks and weeks ago. We've been telling people about it for weeks and weeks. It's been pitifully slow just to even accept that that is a big issue. A big mega lab will have difficulties. They need to sort it. The smaller labs, it's easier. It's easier for us. Of course it's easier for us. That should have been recognised at the beginning. Lessons could have been learnt from us. You could have used us as research tools to help drive the mega labs. It needed greater imagination, greater leadership, really, at both the political and also, frankly, the scientific and medical level. When we come to look at it, we will see we have many lessons that we should have learned.
OK, I know you want to come back in, Grant, but I just want to take one more question if I can. We've actually spent a long time talking about these things. I've not gone quite as many questions as I'd like. But let's hear from Julie Benson.
Good evening. My name's Julie Benson from Leeds. I would like to ask the panel, why, unlike in Australia, when people were flying back in before they closed the borders, people were made to isolate into a hotel for 2 weeks and weren't allowed to go home until they were tested and cleared. I would like to understand why we're not taking those kind of measures in this country, why we're allowing people to fly in and not isolating them the same in a hotel. Thank you.
And week after week, while we've been doing this new version of Question Time, this question has come up, which is why I want to take it tonight. Jean, I'm going to start with you. This is happening in Scotland as well as the rest of the UK. Is that going to change, or are we just going to let people come in willy-nilly?
Well, we can't make that decision here in Scotland because the decision about our ports, whether they're airports
or... Of course, it's not divulged. What would you like to happen?
Government. But our view, my view, is that what the questioner has just asked is absolutely right. And so we will be wanting the UK government to give very serious consideration to stopping the inward transmission of the virus, particularly given the fact that the people across Scotland and indeed across the UK have worked so hard to successfully suppress it to this point. It seems to me foolhardy to then not give very serious consideration to what we do about international travel, both into and out of the UK.
And is this something you've been pushing for as the Scottish Government?
It's something that we have raised, and in the continuing discussions as we collectively look across the 4 nations about what measures might we take to ease the lockdown in any respect, that will be one of the areas that we will want to pursue with the UK government and with the Prime Minister in the discussions that we have.
I mean, Annalise, people, as I said, people have been asking this time and time again and just can't seem to understand. To be honest, I'm not sure I can either. Why, when so many other countries, Australia being one, but a lot of other countries, put people into quarantine if they come into the country, we're not doing that. Would you like to see that change?
Well, I think there have been very serious concerns around this, and what we've been saying to government is that it needs to be open around its reasoning on this question. I mean,
so it's not that you'd like it to change, but you just like to understand the reason.
Well, we need to understand why that decision has been taken, because you're right, practice in other countries has been different. Actually, if we look at people who've been coming into the country, I've been dealing with huge numbers of Brits who are all around the world who would desperately love to be back here and are being brought back at a much slower rate than if they were another country's national. But, you know, hopefully Grant may be able to enlighten us a little bit more, because I accept that on the one hand, you know, for example, some of the measures that were put in place in other nations haven't necessarily worked. For example, you know, temperature measurement as people come in, because, you know, that's not robust, obviously. But I think we do need to look at the fact that potentially there have been people coming into the country who might have been taking the virus with them. I suppose that the problem is this is then conjoined with that testing issue. I'm sorry to bring it back to that. I know we've just been talking about it, but, you know, if people who had come back into the country had then been able to quickly access a test for themselves to know what their situation was, then, you know, we could have dealt with this more robustly. I think this is more of an issue because we don't yet have that community testing in the UK to the extent that applies in many other countries.
Henry D has tweeted in, we're all on lockdown, so why not ban people coming into this country without being tested? And they should spend 14 days in quarantine. I mean, interestingly, Australia and New Zealand were introducing this policy when we were going to the Cheltenham races. I mean, is this going to change, Grant?
Yeah, different countries are in different parts of or different moments in this pandemic at different times. But whilst it's endemic in this country, and in other words, prevalent amongst the population, it makes no great difference to the overall figures according to the scientists and the medical experts. However, that changes as we get a grip of those numbers and then becomes something that is actually very valuable to do because you can stop it from coming in. So we're starting to use the classic flattening of the curve. It's starting to come down. There is the important point, of course, as Annalise raises, of returning British nationals who are abroad here. But it's absolutely true to say, I think if the British people themselves are being asked to continue with social distancing measures, then it's quite right to expect people coming into the country would have the same measures applied to them. So it's actually something that very much, as we get to the smaller numbers and not wanting to see a repeat of the infection, something very much as a live discussion.
Paul?
I think this is obvious. We should be doing it. I hope with the capacity for testing that we would have in place and with the recognition of the importance of this, in the coming months we'll introduce this because this isn't going to go away in a hurry. We need it.
And you do other things as well. You'd require people coming into the country to download the NHS app for the tracking, tracing purposes as well. So it's got to be the same rule for everybody. So I entirely agree with the questioner. It's got to be the same thing for everybody.
George?
I mean, look, I think the lesson of all of this is treat the public like adults and explain to them exactly why you're doing these various things. And I think, you know, otherwise people sit at home and they go, hold on, like there's a lone walker in Derbyshire and they've got a drone following them and barking at them to go back home, when you've got like thousands of people going through Heathrow Airport. And, you know, Grant says, the scientists tell us at the moment that's not statistically significant. Well, then the lone walker's not statistically significant either. And I think, you know, I think we've passed through the phase of the crisis where, you know, because people are very afraid, understandably for themselves and their loved ones, they'll just take the word of the government, and the Prime Minister, you know, stands there, as he did again today, and he's, you know, very impressive and optimistic when he does that. But I think we're coming to the end of just taking the kind of ministerial diktat. People are getting their information from all over the world about how different countries are dealing with this, how different opinions on how it should be done. And I think we're moving into a phase where actually it's in the government's interest to open this up, explain all their thinking, and carry people with them. Try and carry the opposition with them, try and carry the media with them, but above all, try and carry the public. And whether as a newspaper editor or indeed as a former politician, I always found if you treated the public like adults, they responded like adults.
I think George is so right there. I'm not sure we've been treating the public, society, as grown-ups. I mean, we've had these sort of slightly weaselly explanations about what we should be doing and, you know, capacity and all of these sorts of things. We are in a crisis. We know it's difficult. We need, for leadership, you need to actually be seen to take on the problems and explain them. And I think that's the way through it. I add to that, also, we have to act better as a community as well. We have to work together to get this through. But we need proper leadership, proper transparency, proper communication, so that we can get through that with a better community.
OK, I'm afraid, I know you want to come again, but we are out of time, I'm afraid. Our hour is up. Tonight, our recorded questions came from Leeds in this virtual new world that we're living in. Next week, we're looking for questions from people living in or around Newcastle, and the week after that, from Oxford. And, of course, you can't come to the studio, not yet, anyway. Gosh, I can't wait, actually, till that can happen again. But we do still want to hear from you, of course, because you are what makes Question Time what it is. Your questions experience is so important. So if you live in Newcastle for next week, get in touch by going to the Question Time website, apply in the usual way, let us know what you want to say, and then, if asked, you'll record your question. We can help you with that if you need it. I'm sure you won't. But and then send it in, just like the ones you saw this evening. And if you want to join the discussion on what we've been talking about, you can, in the usual way, join Adrian, Charles and guests on Question Time, Extra Time, and that is on 5 Live now. But for now, thank you very much to all of you for coming into the studio. That is a big ask, and I'm very grateful. We're all grateful to that. Jean, thank you very much for joining us from Edinburgh. Very good to have your contribution too. Thank you to everyone who recorded a question or got in touch on social media. And, of course, thank you to you at home for watching from Question Time. Bye-bye.
This is a